So you've said that you've been talking about the coronavirus for some time now. Some in positions of power seem to have discovered it like 10 days ago. What do you think so far, as someone with this background in medicine, what do you think about the overall response to coronavirus inside of the United States?
I think like many people, I'm disappointed in the way that the federal government woke up to this so late. I think there were people in the federal government who were talking about the right things and trying to prepare us. And unfortunately, I think those in leadership positions weren't necessarily hearing the warning signs. This is something that we should have known about for many, many, many years, actually. The CDC, the NIH have been preparing for this, but have been underfunded by our federal government. If you go back all the way back to the Affordable Care Act, which we just celebrated its 10-year anniversary, that act set aside money every single year to prepare us for a public health threat like COVID-19. And every year, Republicans were in charge of the House and the Senate, and every year that Donald Trump has been in office, they have cut funding to that specific fund by $8 billion.
Wow.
That $8 billion cut has now resulted in a $6 trillion investment that we need to do to bring our economy back online. And I think that was the right thing. We have to get our economy back. We have to fund tests and the research and everything we need right now. But in a few months, we're going to have to look back and recognize that $8 billion investment that we could have made would have been worth every single penny and would have prepared our country in a way that we just weren't prepared for this current pandemic.
So you mentioned there that we have to get, our economy back going, and, Trump seems to, at least as of now, backed off of his Easter, restarting the economy drive. I saw that your governor, Charlie Baker, just extended the state's lockdown until May 4th. How much certainty do you have that by May 4th, your state or the rest of the country will be ready to go back to normal, or whatever normal is at that point?
I think May 4th is an optimistic date. I think we're all hoping that social distancing was put in place early enough, certainly in the Commonwealth of Massachusetts and all across the country, that we can see the peak of this pandemic in late April and see things get better by early May. But I think the reality is we have to be prepared that this can go on much, much longer than May 4th. We've got to put some dates on the book so that we have things to work towards. But from the infectious disease side of this, from the public health side of this, I do think we need to be prepared for months of being distant from each other to make sure that the virus doesn't come back in a second wave, to make sure that we truly get control over what's going on in some of the hardest hit places all across this country.
I'm curious. I probably should have asked this earlier, but are you still practicing as a doctor while campaigning?
I am, yes. So I continue to do both jobs. We actually had intended that I would start to phase myself out of the hospital around now so that I can campaign full time. But obviously, when the largest infectious disease threat hits our country, as an infectious disease doctor, I felt called to service and have continued to work in the hospital. That's been challenging, but it's also really affirmed for me why I'm in this race, why we have the values that we have in this campaign, and why we're fighting for every single person to make sure that they can have access to healthcare, that they can have access to housing, that they can have access to a living wage and paid sick time.
You're one of the first either doctors or nurses, any kind of medical professional that I've talked to in some time, and this is obviously a very exciting time. Tell me about continuing to practice. Are you worried about potentially being exposed? How do you feel about the amount of personal protective equipment that you have access to? The nation seems to be really focusing on the needs of medical professionals. There's a lot of goodwill going towards anyone working in that field from regular people. From the government, at least as an outsider, it seems like the priority it's not necessarily being prioritized to the level that it seems it needs.
Mm-hmm. I'm really lucky. I work in a hospital system. Mass General Hospital has a tremendous amount of resources, and we've been able to make sure that we have the personal protective equipment we need, that everyone who walks into the hospital gets a mask. Whenever someone is in a high-risk setting, they can make sure they have all of the equipment that they need. But that doesn't make it any less scary to be a healthcare provider right now. And I think we need to recognize that people who are in healthcare, from the physicians to the nurses to the aides that are coming in and the people who are cleaning the hospital and serving the food, we're all making a choice to go out there and do everything we can to support this country and support the people that are coming into the hospital. And we're making that choice because it takes a little bit of courage and some bravery and to swallow down that fear a little bit to get into the hospital. I have a lot of conversations with my husband, who is very nervous about me going into the hospital and seeing patients, what that means for me, what that means for him. And we get through this together every single night, just acknowledging our fears and saying, this is the right thing to do. This is why I'm a doctor. And this is really why I'm running for Congress.
And because you have this experience, I'm curious what you feel like could be done to assuage some of those fears, to make the next couple of months possibly as easy as they can be, given the circumstances. If you were in power right now, like we've seen the recovery bills that they've passed, what should the next steps be? What would you like to see as someone coming from the medical field?
I think there's a lot that I'd like to see in what we'd call phase 4, the next step of the stimulus package. And that includes additional money for ventilators and for testing, more help for people who are going to be affected by social distancing so that we can really continue to encourage social distancing. But one of the things that I think we have to recognize in phase 4 is that hospitals all across this country are being put in really challenging positions right now. They are shutting down their outpatient practices, they are stopping elective procedures, and they are losing a tremendous amount of money. And they are making decisions about furloughing physicians and nurses and other staff in the hospital, cutting pay to the people who are running into the fire right now. We need a federal stimulus package that supports our hospitals and supports our healthcare workers. It is not acceptable for the people who are really on the front line of this pandemic to risk losing their pay, losing their benefits, losing their own health care just because they're in a hospital system that can't be funded appropriately right now.
And where can people go to find out more about your platform, more about your candidacy?
People should check us out at robbieforchange.com or find us on social media at Robbie for Change.
Okay. Dr. Robbie Goldstein, we really appreciate you joining us today. Thank you.
Thank you so much for having me.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.